And I would request Dr. Benny Jeng to give his talk, the first talk of the day, that is the status of corneal surgery in USA. I think we all have to learn from each other and have to know what they are doing. They've already started. So, Benny, would you please give your presentation on what is the status of corneal surgery in Australia, in USA?
The USA. Can everybody hear me?
Yeah.
Yes. So first of all, thank you to Professor Narmada for inviting me, as well as the panel for inviting me to present here today. I'll talk about the status of corneal surgery in the US in 6 minutes. I have no relevant financial interest to disclose. And, this pandemic has changed everything, right? In the last 6 months, things are completely different. This was Rich Abbott and myself in Taiwan. Um, as what was normal, giving presentations just back in December. And now with coronavirus, everything is very different. Now we're doing this. This is how we see everybody. And while it's nice to be able to be in India right now for an hour, it's not the same. I can't talk with my friends afterwards and at the reception, have dinner. And then, on the practice side, things are very different. We, as cornea specialists, when was the last time we had to wear face shields in the operating theater? I don't remember that ever. So lots of things have changed for us. In order for us to understand how things are different in the US, I think a little bit of background needs to be understood about what goes on in the eye bank, and I think we might hear more about this. But this is data from the 2019 statistical report from the EBAA. And you can see from the early 90s to the mid 2000s, number of transplants, tissue that was procured in the US used for transplantation stayed relatively steady between 40 and 50,000. And then it started to increase steadily. And I feel like we're somewhat at a plateau, but it will almost hit 80,000 transplanted tissues used from US eye banks. So 50,000 in the US and 30,000 exported internationally. This is also very important for everybody to understand. This is in the US, everybody knows this. In 2011 was a inflection point where EKs took over PKs as the more commonly done procedure for keratoplasty in the US. And this is important in a couple of slides from now. So what happened during the lockdown in the United States? The biggest time period was from April to May. And so this is actually a bar graph from my own practice, our practice at the University of Maryland. And you can see here on average, we were at a certain level. In March, when the pandemic hit halfway through, our volumes dropped in half. And then in April and May, we're really locked down. We tried to do some telemedicine, but that was very, very difficult for cornea and retina stuff. And then in June, we opened up again to about 50%. And you can see our volumes increased a little bit there. So how did that reflect on corneal surgery in terms of what we did? Well, April and May, there was a significant drop in keratoplasty volume, not just in our institution, but across the country. In speaking with a very large eye bank in the US, they said that their volume dropped to 10% of normal. And what was interesting was that the ratio of PK to EK was much higher than usual. Remember the graph I showed you where EK was the more commonly done procedure? PKs were the ones that were predominantly done. Why? Because we're only doing emergent and urgent cases. And so routine endothelial keratoplasty was not being done, but perforations, only perforations were the ones that really were being done. So there was a change in the characteristic of the type of surgery that was being done, in addition to the volume dropping significantly. In June, the country basically went back to work at half capacity. The clinical volumes for most clinics were limited by being able to maintain social distancing. And so with that, surgical volume increased with the resumption of elective cases in most hospitals and ambulatory surgical centers. Kathy Colby, who is the president of the Cornea Society, polled us as board of director members in June and showed that in terms of the US, resumption of corneal transplantation, 50%, 75% of people were at 50% baseline or higher. So in the green and the purple, and 45% of Cornea Society board members were operating at greater than 50% of their normal baseline. And we have members distributed across the country in various different settings, so we use that as a representation. I repolled the board of directors 6 weeks later, so just a couple of weeks ago, and this is what we looked at. We've advanced more even in July. Almost 90% of members are now operating at least 50% of baseline, with 75% greater than 50% of baseline, And of the 74%, half of them, so about 37% of cornea specialists, if we use the Cornea Society board members as representation, 37% are at 100% of their normal capacity. So over 1/3 of cornea surgeons are back to where they were before the pandemic for surgery. COVID testing 8 weeks ago was required only in about 72% of hospitals, and now it's almost 100%. So there's testing done and surgeries are resuming in the US. But what are the major concerns? Concerns of surgeons is, even in the US, donor supply and quality. We know that there's a rigorous screening program, as there is in India and other parts of the world. And so we are worried about tissue being screened out. We're also a little bit worried about tissue that has not been screened out and whether or not the testing is 100% reliable. And are we going to be transplanting tissue that actually is from people who have COVID? And is it transmissible? You know, there's data that suggests that there's not, but we're not 100% sure. Patients are having issues with having surgery during the pandemic. They don't necessarily want to come in to be exposed or infected for elective surgery. And for people who are coming from far away, there are restrictions of travel within between different states. And so people are concerned about traveling to go get surgery. And then a global worry in the US is about the second wave of COVID-19 that we anticipate will be coming later this year and forcing a second shutdown for elective surgeries. And so that's heavy on our minds here in the US. So COVID-19 has definitely changed our world, including corneal practice. But I'll say that in the US, corneal transplants have really restarted in the last few months, and especially in July, a lot of surgeons are now operating at normal capacity for corneal surgery. But the majority are probably still at somewhat lower than normal volume, although 50% is kind of a minimum for most people. There are still some concerns about availability of tissue and what COVID testing means, although the eye banks are very rigorous about testing for COVID. And then, of course, there are concerns about safety from the patient standpoint, as well as what might happen later this year with the second wave. With that, I hope that I've given you a little capsule of what's going on in the US from a cornea surgeon perspective. Thank you.
Thank you so much, Benny. So what we would like to know from you is that uh, you are doing COVID-19 test for all the donors that you are taking the corneal tissues from.
Yes.
Are you testing all the donors?